Social Justice Analysis, Nurses in a Bubble, MIchelleStough. Have we lost sight of the big picture? When I was reading Beckemeyer and Butterfield's article, I completely agreed with them in the fact that nurses and nursing in general has lost our sense of direction. I think that there are the few individuals that work tirelessly all of the time that see the big picture, but what I know for myself personally is that I'd lost sight of the big picture, that I had become a staff nurse, something which I've done for 4 years, something which I love, and something which I think I'm good at. But I think I had lost sight of why do the people keep coming back in? Why do I have the same patients cycling through the hospital weeks apart and sometimes even days apart? Why can't they afford their medications? What are we not doing to help these people? Or why are we not helping these people? I help them, sure, in my 12-hour shift. I give them their medications. I do my discharge teaching. I make their follow-up appointments. But what is the big picture? Why am I not moved to change policy or to advocate for my patients as a whole? And I was really grateful for the Beckemeyer and Butterfield article, and I wholeheartedly agree with it. Lost voices. As Farmer 1997 states, quote, "We missed our chance to heal." Inequalities with regards to access to quality health care equal poor outcomes for our patients. We know this. The research shows us this. In reading prophetic voices, you hear Farmer detail different stories about people with poor health outcomes related to the kind of care and their access to care. One of the things that struck me the most was non-compliance. I hear that a lot at my job. I hear people talk about non-compliant patients or he or she is non-compliant. But am I really stopping to think, why are they non-compliant? What is going on in their life that makes them non-compliant? Are we as a society just setting them up to be non-compliant? I think that may be one of the biggest things that I walked away with after reading Prophetic Voices. We're setting people up to fail at their own health, and then we have to take care of them. We miss our chance to heal them. Instead, we then become like a firefighter putting out fires related to their health. Theory of Human Liberation, The Privileged versus the Disadvantaged, as detailed by Chin, 2015. Frere's theory of human liberation is very distinct in lining up traits that are distinct and unique to the privileged, and then traits that are distinct and unique to the disadvantaged. As a clinician, you have to be aware of the traits of the disadvantaged, how they will be disenfranchised or not empowered to make change. So that's where it comes back to listening to yourself and your conscious as a nurse and being moved to make social change, to help the disadvantaged have privileges that are not always entitled to them. Daily, I come into contact with the mentally ill. They often take up a lot of room in our emergency room. We're not able to care for them. We're just trying to find placement for them. They definitely have all the characteristics of the disadvantaged, and they're definitely a population that is falling through the cracks, that doesn't have people fighting for them and fighting for their rights. So that definitely resonated with me when I was reading about the theory of human liberation. Also, as it related back to social justice and being moved to make changes on a bigger level as a nurse. Room for improvement. Chin discusses emancipatory leadership. She talks about the importance of working together within an organization, individuals coming together to the table to facilitate change. Perhaps that's the best way that we as nurses can begin the process of being involved in social justice. I know at my hospital there are several different committees. I sit on a couple of them. I'm involved in Nursing Congress, and it's amazing to me how just sitting with 5 other nurses and discussing a patient outcome in general, or readmission rates with congestive heart failure patients, how when people start to bring their new experiences or their different experiences to the table, we can all sit together, talk, brainstorm, and facilitate ideas and concepts that hopefully we are able to bring to leadership and start to begin the process of change. I think if we can take that and move it to a bigger level in terms of social justice, we can start to make healthcare equal for all and work as a group with all of our ideas from all over the country to facilitate the change that Shin speaks about, which in turn will help bring about nurses and lobbying for change wherever their setting may be. In conclusion, after reading Unreconciled Inconsistencies, Prophetic Voices, and the chapters in my books, I've come to realize that we as healthcare professionals are charged with a greater sense of duty. We must take on social justice. We must work tirelessly at it to even the playing field, to live outside of the bubble of direct patient care, to stop providing care in a silo, and look at the bigger issues. I was enlightened, disappointed in myself, but overall optimistic about the changes I can now make in my practice going forward as it relates to social justice. Thank you.